Actually, this one is more like a revision to you because you have already learned about the meninges in the first semester. Okay, I already informed you about the meninges inside a little bit inside the introduction to the central nervous system and also the peripheral nervous system. So probably you may learn more detail about the venous blood sinuses, right? And then how the ventricular system, where you can see that the lateral ventricle, we can divide into a few parts, okay, like anterior lobe, anterior part or anterior lobe of the lateral ventricle, and then the body, the posterior, and also the inferior lobe of the lateral ventricle. So this is actually the meninges. Okay, first of all, if let's say the question asks you define the meninges, you have to know that it is actually the connective tissue, okay, or membrane, okay, the membrane that gives protection to your central nervous system, okay, with your brain and also the spinal cord, right? Give protection and also support, right? And then you know that the meninges can be divided into 3 layers. Okay, we have from outermost to the innermost, starting with a durameter, right? Durameter, and then the arachnometer. Okay, the durameter, the outermost, or sometimes they call it as a tough mother. Okay, because it is actually very strong. Okay, very strong layer. Okay, very strong layer. And then next one, you can see that the arachnometer. Okay, the arachnometer is with projection. Okay, with a projection, it looks like a trabeculae. Okay, inside the arachnoid space. So that's why they call it as like a spider mother. And then the pia meter, or also known as a soft mother, because it closely covers your parenchyma of the brain. Okay, so meaning it will go running through together. From the surface of the brain, it will go downward, okay, follow your gyrus, okay, for the pia meter. And then if you can see that we have just very brief here, so this is actually the cutting of your skull here. Okay, you can see that how your skull consists of how many layers. We have starting with the skin, right? The skin, and then followed your skull. Your scalp, okay, your scalp here, we have a skin, and then C for the connective tissue, and then after that A for the aponeurosis, L for the loose connective tissue, and P for the periosteum. So if you can see that the periosteum of skull here, and then below to the periosteum of the skull, presence of the space, so we call as an epidural space. Okay, the epidural space, where it consists of highly vascularized and contain loose fibrous and adipose tissue. And then after that, you can find the durameter, okay, the durameter, okay, where actually the durameter, later on you will learn in detail, it consists of 2 layers, okay, 2 layers, the outer periosteum or osteal layer, and the other one is the inner meningeal layer, okay. So what was support is the outer periosteum, because from the brain, okay, not all the durameter will be continued downward, cover the spinal cord. Okay, it will not going downward to get the both layer. Only one layer will be going downward through the foramen magnum, then cover the spinal cord. And then below the durameter, we have another space. We call it as a subdural space. And then after that, you will see the arachnometer. And then after that, in the arachnometer, presence of this subarachnoid space, okay, subarachnoid space, and then this subarachnoid space in certain area of your brain here, it will have like a widened space, okay, it's a widened space where the space we call as a cistern. So got so many cistern in the skull or the brain here, like you have like a cerebromedullary cistern here, lateral cistern, pontine cistern, so many cistern. Alright, so where sometimes when we having failed to collect CSF from the lumbar puncture, you can do collection of the CSF from the cistern. Okay, normally they collect from the cisterna magna, okay, from here. And then after that, continue with pyometer. So we look at the durameter here. So you can see that actually it is actually the outermost and thickest manager layer, a tough, white and durable layer. Okay, actually it's a very strong. Okay, very strong layer. So later on during the practical, session in the EDH, we'll try to see the durameter. Okay, then you can feel, you can palpate how actually it's very strong layer. Okay, very strong layer. So it consists of the dense connective tissue with the collagen fibers. And then you can divide the durameter based on the durameter cover the brain, we call it as a cranial dura, whereas the durameter cover the spinal cord, we call it as a spinal dura. Okay, so for the cranial dura, see here we have an outer endosteal layer or periosteal layer. Okay, periosteal layer. And then the other one is the inner meningeal layer. So this inner, the outer one, it will not continuous. Okay, it will not continuous. Okay, and then the inner layer here, you can see that it will be continuous through the foramen magnum with a spinal dura, spinal dura. So this one actually you can compare. Okay, you can do comparison between the durameter and also the inner meningeal and also the outer endosteal layer or periosteal layer. So which one is actually, it will be folding inward to become as a fox. Okay? It will be folding inward to become as a fox cerebri, or maybe the tentorium cerebelli, and also the fox cerebri and the sella. Okay? The sella diaphragm. So this is actually the things that I mentioned to you. So the inner one, the inner meningeal layer of the durameter, it will be go inward. Okay, in certain area, okay, in certain area of your skull here, it will be go inward. The inner meningeal layer go inward. Okay, go inward to form the septa. Okay, to form the septa. This part here. So we have here got four. Okay, the first one is a fox cerebri. Okay, the fox cerebri, it looks like a crescentic in shape, and then it's located or it's separate to cerebral. Okay, to cerebral hemisphere. And then next one actually is the tentorium. Okay, look like a tent here. So it forming a roof for the posterior cranial fossa. Okay, so it actually separate your cerebellum from the occipital lobe of the brain. Okay, occipital lobe of the brain. And then next one is a fox cerebelli, located between the cerebellum, okay, to cerebral hemisphere. And then next one is the diaphragm ocelli here, okay, diaphragm ocelli, where it will form like a circular fold over the sella turcica of the body of the sphenoid. So this is actually related to the cranial dura. So it receives arterial supply from the middle meningeal artery, okay, middle meningeal artery. So you can see that middle meningeal artery. So when you look at if you still remember your skull, there is the weakest point in your, the weakest point, the weakest part. What we call that one? The point? We call it as a what? Anybody? The weakest point of your skull. So you can cross the epidural hematoma. If you poke here, so there is where your four sutures will be four bone will be fused together at this point. We call it as a pterion. The weakest point of your skull known as a pterion. So below the pterion there is a anterior division of the middle meningeal artery. So if you poke into that side, you can cause a bleeding. Okay, the anterior division of the middle meningeal artery. So you can see that here how actually the epidural hematoma is look like look like a half of a pie. So like macam tu lah, is a half of a pie kan. So you can see like a lens. Okay, sometimes it look like a lens shape. Okay, and then this one later the epidural hematoma, it will cause like a lucid interval. Okay, maksudnya lucid interval tu you sedar and then you pingsan, then you sedar balik and then maybe you pingsan balik. So there is a lucid interval. Alright, so this one you can read from here. So you can the hematoma here, you can see that it look like a lentiform. Okay, lentiform or lens shaped like collection. okay, or look like a half of your pie, okay, because you have to differentiate between the epidural hematoma or extradural hematoma with the other one is a subdural hematoma. So subdural hematoma tu bentuk dia macam banana, okay, macam bentuk banana. So for this subdural hematoma, but that one actually involve your bridging vein, okay, bridging vein. This one for the epidural hematoma, it involves the artery, okay, the anterior division of the middle meningeal artery. So now we look at the spinal continuous. So we have a spinal dura here. So you can see that the spinal dura, it will form a sac, okay, a sac surrounding the spinal cord, okay, sac surrounding the spinal cord. So the spinal dura actually, as I mentioned to you, actually a continuation from your inner meningeal layer of the dura mater. It's not from the outer, okay, outer periosteal or osteal layer of the dura mater. And then this spinal dura, okay, it extends from the foramen to the level of S2 vertebra, and at the caudal termination of the dura invests the phylum terminale to form a fibrous cord known as a coccygeal ligament, okay, known as a coccygeal ligament. And then you can see that outer, okay, outer to the dura mater here, it separates from the periosteum by the epidural space, which contain the internal vertebral venous plexus. So if you look at the diagram here, we have two venous plexus. One is outside, and the other one is outside. Main is outside here, okay, outside of the vertebrae here. Okay, we have anterior and also the posterior external. Alright, and then also inside here we have also anterior internal venous plexus. Alright. And then this is actually more about the coccygeal ligament. Okay, more about the coccygeal ligament. You can read by yourself. So from here, actually, you know that what actually is a phylum terminale. Phylum terminale actually is a thickening of what? Thickening of what? Right? Thickening of the pia mater, dura mater, erector mater. Which one? It's a pia mater, right? Okay, it's a thickening of the pia mater. So it will go downward. So it will go downward and then it attached to the first coccyx. Okay, first coccyx. So if you can see here, you can divide the phylum terminale into internal and also the external. So external phylum terminale, it invests by the coccygeal ligament. So it actually helping, okay, it helping facilitate attachment of the spinal cord to the coccyx for the coccygeal ligament. So beside the phylum terminale, what else form from the thickening of the pia mater? What else? Beside the phylum terminale, what else? Actually, is a form from the thickening of the pia mater. It's actually one is a point downward, the other one is a point laterally or transversely, known as a ligamentum lenticulatum. Okay, so this is actually the applied anatomy. So you can give a spinal anesthesia. Okay, spinal anesthesia. So as an approach for the paravertebral nerve block. So beneficial for the for this one actually is spinal anesthesia compared to the general anesthesia, and it is suitable for the abdominal operation and also for the lower segment cesarean section, or we call it as a LCCS delivery. And then also you can involve with a lumbar puncture. So normally lumbar puncture you will do at the for the adult at the level of L3 to L4, whereas in young age, okay, between the L5 and S1. So because you have to know that the spinal cord will be acting at the level of what in adult? At the level of lower border of L1 and, okay, or in between the L1 and L2. But for young age, it will be acting at the level of L3, okay, the L3. So this is a similar. Okay? So if you look at this diagram, okay, you can see that we have layers, right? Layers of from your scalp, okay, from your scalp, and then what else you can appreciate that we have here the vein. Okay, look at the vein. Okay, you can see that there is a vein. So you have to know, you have to differentiate, because you have learned about a few veins during your head and neck region. Then we have a deep vein, the emissary vein, and then the superficial vein, okay, vein of scalp, and then also we have a cerebral vein, okay, where the cerebral vein here actually is located inside this subarachnoid space. So if I give you this diagram, can you name the vein and the structure here? So if you can see from here, actually the coronal section, okay, the coronal section of your head, all right, and then you can see that here we have layers of scalp here. We have a skin, and then also the connective tissue, the aponeurosis, and then the periosteum. And then look at the bone here. So the diploid bone, okay, diploid bone here, or spongy bone here with a diploid vein, okay, with a diploid vein. All right. And then you can see we have here in the connective tissue here, presence of the superficial vein of scalp here. And then from the extradural or epicranium here, so the vein, how actually this vein here from the outside will be continuous or having connection with these dural venous sinuses. Okay, how it will be continue with this one, through which vein? Through which vein? Through the emissary vein. Okay, through the emissary vein. So the emissary vein is specific for the emissary vein. Is it consists of valve or not? It is a valvulus, kan? It is actually the valvulus. So actually it can go running in not one direction but in the many direction. So from here also it can bring the diploid vein to your dural venous sinuses. So from this part actually you can see how actually the meningeal, the inner meningeal layer going inward, okay, to form the falx cerebri. So between the two hemispheres. So we have a superior sagittal sinus, okay, superior sagittal sinus. So look at how the cerebral vein here, it need to pass through the layer here, the dural, the arachnometer, and then enter the dural venous sinuses. Same with this one, okay, same with this one. You can appreciate that how actually what vein we call this one, what vein we call this vein here, and then what we call this vein. Okay, so make sure you know which one is a superficial cerebral vein, which one is emissary vein, which one is a diploid vein. Alright? And then look at how the cerebral vein, okay, how the cerebral vein here is running into the dural venous sinuses. So this is again, we look now to the more specific on the reflection done by the inner meningeal layer. So the first one, we have here the falx cerebri, okay, the falx cerebri. So the falx cerebri, if you look at this one, actually it looked like a sickle shape, okay, the sickle shape of the fold of the durameter, and then it running, it's still in between your two cerebral hemisphere, right? So this in the anterior actually it attached into what? It attached into the internal frontal crest and also the cristae here. Okay, cristae. And then in the posterior part, okay, it blend in the midline with the upper surface of the tentorium cerebelli. Okay, listen carefully. You have to know that in the falx cerebri it consists of three sinus having relation with it. Okay, three sinus. Okay, one sinus is located at the fixed margin, okay, kat atas ni. Another one is located in the free margin. Okay, so yang fixed margin here is known as what? The superior sagittal sinus. Okay, the superior sagittal sinus is located at the upper fixed margin, whereas the inferior sagittal sinus is located at the lower free margin. Okay, lower free margin, and then here along its attachment to the tentorium cerebelli, okay, presence of the straight sinus. So if let's say the question asks you, name the sinus having relation with falx cerebri. Okay, falx cerebri, what are they? The superior sagittal sinus, which is located in the upper fixed margin, and then inferior sagittal sinus, which is located at the lower free margin, and then attachment to the tentorium cerebelli, consists of the straight sinus. Okay, now we look at the tentorium cerebelli. Okay, the tentorium cerebelli is look like a crescent-shaped fold of the durameter that cover or roof over the posterior cranial fossa. So this actually is a complete like this. Okay, it's complete like this, but they cut. Okay, this is still present of the tentorium cerebelli, but here we already removed the tentorium cerebelli. Right, we already removed the tentorium cerebelli here. So so this tentorium here actually cover the upper surface of the cerebellum. Below to it presence of the cerebellum, and then above to it actually it support the occipital lobe of the cerebrum. Okay, so I want you to look what actually the tentorial notch and tentorial notch or tentorial incisurum. Okay, incisurum. So actually the tentorial notch actually is the clinical important. Why you have to know? Because there is like an opening, okay, like an opening there where the opening it allow the midbrain connect with a pons, okay, connect with pons. So because of this one, actually we have like a opening there. They divide the area into supratentorial region and also the infratentorial region. So when there is like a hernia of the insula hernia, so it may go through the opening, okay, through the tentorial notch here. So it can cause a insular herniation. So I want you to go more detail about this one, okay? Cari sendiri apa dia. Okay, next one is a falx cerebelli. Okay, falx cerebelli actually is a small. Okay, it go downward. Okay, from this one here, it go like this. Okay, it go like this. So it's a small sickle-shaped fold of durameter that is attached to the internal crest, okay, internal occipital crest, and project forward between the two cerebellar hemisphere. And then the posterior fixed margin, okay, posterior fixed margin consists of the occipital sinus, okay. In the posterior fixed margin contain of the occipital sinus. So the occipital sinus actually the smallest dural venous sinuses, okay, the smallest dural venous sinuses, and then it communicate with a posterior internal vertebral venous plexus and end in the confluent of sinus. Okay, and here the confluent sinus here, so you communicate that, then end at the confluent of sinus. So again, you can create your own question. Which one is located at the fixed margin of this one, and then at the free margin, lower free margin, at the attachment along your along what tentorium cerebelli just now, and then at the fixed margin of the falx cerebelli consists of the occipital sinus. So next one is the fourth one. Okay, the reflection here is we call it as a diaphragma selae here. So this one actually it will be it form roof for the sella turcica. Okay, forming the roof for the sella turcica with a small opening. Okay, with a small opening for the infundibulum of the pituitary gland. We've got small opening for the pituitary gland. So we have here. So later on you have to know what actually the structure located here. Okay, in the old tomcat. Okay, look at this part. So this is actually the dural nerve supply. So from where it received innervation? From the trigeminal nerve, vagus nerve, and also the first three cervical nerve. Okay, first three cervical nerve meaning from the C1, C2, and C3, and also from the branches of the sympathetic system. And the dura actually is sensitive to stretching, which produce sensation of the headache. So kalau dia stretch, so it can cause a headache. So what about the dural blood supply or the arterial supply? It received from, I'm a vet, okay? Okay, I'm vet officer. Okay, internal carotid artery, ascending pharyngeal artery, maxillary artery, vertebral artery, and also the occipital artery. Okay, then this one actually the arterial supply for the dural. So the most important actually is your medial meningeal artery. Actually from the which come from come from where? The medial meningeal artery? Anybody? Medial meningeal artery, it come from where?
ICA.
Axillary. Axillary. From where?
Internal carotid.
From where?
Internal carotid.
So remember this one I mentioned to you is having connected with your soft spot here, okay? The soft, the thinnest part, okay? The weakest point of your scalp. So injury to that it can cause a epidural hematoma. And then what about the dural venous sinus? Okay, the dural venous drainage. So we have a meningeal vein, okay, where the meningeal vein here is lies in the endosteal layer. And then the middle meningeal vein, okay, we have a middle meningeal vein, actually accompany the middle meningeal artery, and then it will be drained to your pterygoid plexus, okay, the pterygoid plexus or the spinoparietal sinus. So normally the middle meningeal artery lie lateral to the middle meningeal vein lie lateral to the artery. So now we look at the arachnoid meter. So for the arachnoid meter, so just now it's look like is also known as a spider mother, right? Spider mother. So you can see that presence of the light membrane between the dura and pia meter. And then below to it consists of this subarachnoid space, and then we have a cistern. As I mentioned to you, what is a cistern? The widened space of the subarachnoid space. Okay, the widened space of this subarachnoid space means the space between your arachnoid and also the pia meter. So as I mentioned also, if you you fail to do the lumbar puncture, how are you going to collect the CSF? You can collect from the cistern. Okay, you can do the cisternal puncture. For example, like here is from the cisternal magna. So the biggest cistern here. Okay, we call it as a cisternal magna, or we call it as a cerebellomedullary system. Okay, cerebellomedullary system. So this is how the trabeculae look like. Okay, from the arachnoid, and then like the trabeculae. Okay, so that's why it consists of the like we call it as a spider mother. Okay, and then you can see that in the subdural here, presence of the blood vessel between the cerebral vein and also the cerebral artery. So and here, related to the arachnoid here, you can see that we have a arachnoid granulation. Okay, so arachnoid granulation, how are you going to differentiate between arachnoid granulation and also the arachnoid villi? So both actually come from the arachnoid. So the villi you cannot see using your naked eye, but your arachnoid granulation you can use your naked eye. So it's microscopic for the villi, but the arachnoid granulation mean you can use your naked eye to see the granulation. So this is how the arachnoid granulation is look like. Right? So the arachnoid granulation here is covered by the mesothelial cell, and function actually it will absorb, okay, to absorb CSF from the subarachnoid space into the venous sinus. So this is if you look at this diagram, you can see that we have the covering here, the outermost, the covering your dura meter, okay, the very white color, and then very tough layer, okay, and then look at the brain here, still covered with the arachnoid meter, and below to the arachnoid meter we call as a sub arachnoid space, which consists of the vessel. Okay, so vessel here you can appreciate here the superior cerebral vein. Okay, superior cerebral vein, and then inside here actually the inferior cerebral vein. And then got two type of anastomosis. Okay, one we call it as a superior anastomosis or vein of Trollat, and the other one is the inferior anastomotic. Here we call it as a vein of Lavey. So if macam mana you nak ingat, okay, Trollat tu located top T for top, so it's located at the superior. Lavey is a lower, so it's located at the lower part. So this actually they connect. Okay, it bring here. So it help the anastomosis here actually it help the venous blood from this part go to your superior sagittal sinus. Okay, superior sagittal sinus. And then from here, okay, through this anastomosis, it will drain to your the transverse sinus. Okay, so this is again I showed to you the diagram. So I want you to remember very detailed. I mean not very detailed. Know the vein and then the layers, the space and whatnot. There. at this one, you can see that the error granulation, right? So the error granulation, so come first from your villi. So the top of the accumulation of the villi, later on it will become as a granulation. Okay, granulation. So the villi you cannot see using your naked eye, but the granulation you can see using your naked eye. Okay. So look at this part. Okay, you can see from here what we call this space. What we call this space? We call it as a subdural space. Okay, the subdural space. What structure located inside the subdural space? Can you see that? It consists of what? It consists of the cerebral artery and also the cerebral vein. Okay? So the cerebral vein here, it will be penetrating the layer, the dura mater, and then enter the dural venous sinuses. So when it try to enter here, so this one they call it as a bridging vein. Okay, the bridging vein. When it try to enter, if I say it receive like a compression to the vein there, it can cause a bleeding. Okay, so later on it will cause a subdural hematoma. Okay, subdural hematoma. So this is again the diagram to you, so you can appreciate what are we called, what vein, this one, what layer here, what layer here, and then this is actually the spongy part. Okay, diploid vein area or bone, and then consists of the diploid vein, kan? Then which one is the emissary vein? So this is actually your emissary vein. So what we call this one, the erect granulation. So what we call this the space here, so we call it as a what? The subdural space. Consists of what? The cerebral vein and also the cerebral artery. Okay, beside the fluid. Okay, beside the fluid. Okay, it also consists of the fluid. What type of fluid? The cerebral spinal fluid. Don't forget that it consists of the fluid as well. Okay, the cerebrospinal fluid. Okay, from where the cerebrospinal fluid is coming? It comes from the corax plexus. Okay, the corax plexus will produce your CSF. So now this is our information. Superior cerebral vein, okay, located beneath the arachnoid. Okay, and then it traverses the subdural space to reach the superior sagittal sinus. So you can appreciate from here. Okay, from the superior, at first it's located beneath your arachnoid. Okay, at first it's located beneath your arachnoid, and then later on it will penetrate the arachnoid mater and then drain to your superior sagittal sinus. So when it tries to drain, as I mentioned to you just now, of course at first it's located in the space. So when it tries to drain, okay, when after it passes through the layer here, right, and then it drain to the dural venous sinuses here. If let's say it receives like a pressure on the area, so it can cause a bleeding. Okay, cause a bleeding. So this is actually they call it as a bridging vein. Okay, the bridging vein. So you can read about the bridging vein, and it causes when there is like a damage to this artery, it will cause a subdural hematoma. So how are you going to differentiate between the epidural hematoma dengan subdural hematoma? Which one is look like a banana? Banana. B sub SUB, B for banana. So your subdural hematoma. So it's look like a banana. Okay, this part here, and then the other one. Okay, you look at like banana here, subdural, and then the epidural look like a pie. So it's half a pie, okay? So it's an epidural hematoma. So epidural normally involve which vessel? The middle meningeal artery, whereas the subdural hematoma it involve your bridging vein. Okay, so now we look at the subarachnoid cistern. Okay, the cistern. So the cistern just now actually is the widened space. The widened space. What space? The subarachnoid space. Okay, the subarachnoid space. So we have a few. If let's say the space here. Okay, like the biggest one actually we call it as a cisterna magna, or look at the structure near to it. We have a cerebellum and also the medulla. That's why they call it as a cerebello. Medullary cistern. Okay, cerebellomedullary cistern. And then look at here. Okay, look at this part here. So this is actually your midbrain. Your midbrain, the tectum consists of the superior colliculus and inferior colliculus. Superior colliculus for your visual, and then inferior colliculus for the hearing, kan? So the two pair of this one they call it as a quadrigeminal, okay? Quadrigeminal. That's why they call it as this area here, called as a system of cisterna and diet, or the quadrigeminal system. Okay? The quadrigeminal system. Quadrigeminal system here. Okay, they are the name for the system of the great cerebral vein. So because in this part here also it consists of the great vein of Galen. Great vein of Galen. That's why we call it as a system of great cerebral vein or systema vein. And then if you can see that in between your peduncle, okay, in between your two peduncle, okay, between the two peduncle here, there is like a wider space also. So they call it as an interpendicular system. Okay, the interpendicular system in front of your this part, okay, your midbrain, okay, anterior part of your midbrain, and then we have a pontine system. Okay, the pontine system is in front of your pons, okay, in front of your pons, and then next one is in the lateral sulcus. Okay, lateral to the lateral sulcus, we call it as a system of the lateral sulcus or Sylvian system. So of course in the lateral sulcus consists of what? The middle cerebral artery. Okay, the middle cerebral artery. What are the vessels located in the pontine system? Okay, presence of the basilar artery. Okay, the basilar artery running in the groove of the pons. Okay, running in the groove of the pons. Alright. So in this part, beside the great vein of Galen, it also consists of the superior cerebellar vein, where it will be supplying your superior part of the cerebellum here. Okay, and presence of the trochlear nerve, the only nerve that coming from your dorsal part, kan? Betul tak? The trochlear nerve, the only nerve that coming from your dorsal part. And then below we have another system. Okay, below the spinal cord, actually your lumbar system. Okay, your lumbar system. So this part here. So from lower border of the L1 to S. Sacral 2, because your durameter, arachnometer will be ending at the level of S2 vertebral. So we call it as a lumbar system. Okay, the lumbar system, and in this part normally it consists of the column tunnelate together with the cauda equina. So from here also you can see that just now not appear clearly in this one. Here is not stated the chiasmatic system. Okay, this one you can see that in front of your optic chiasm here we have another system known as a chiasmatic system. Okay, chiasmatic system. So a few systems we have this part, your cisterna magna, and then in front, behind your superior the quadrigemina. Quadrigemina consists of what? The superior colliculus, a pair of superior colliculus, a pair of inferior colliculus. So in front, behind to it, from dorsal part we call it as a quadrigeminal system. Okay? And then what else? We have also the pontine system, and then interpendicular system, lateral system, and then the chiasmatic system, and the last one is your lumbar system. So this one is a subarachnoid hemorrhage. Okay, so we have here actually is sometimes you can also see there is like a bleeding inside the space, okay, beside the space. So when there because in the subdural subarachnoid space consists of what? Consists of the cerebral artery and vein, kan? So damage to the artery inside the subarachnoid space, it will cause a subarachnoid hematoma, or we call it as a SAH. So this one normally involve the epineuritism, okay? You punya circle of Willis, okay? Sometimes epineuritism tu, you can see that the artery become like a grape, dia akan jadi gemuk. So rupture of that artery, it will cause your subarachnoid hemorrhage, okay? Subarachnoid hemorrhage. So this is how it look like under your CT scan. It's like a gyriform, okay? The gyriform shape of the blood collection. So this one. So again, you can relate with your epidural hematoma, subdural hematoma, and also the subarachnoid hematoma. Which one is look like a banana? Which one is look like a I? Which one is look like a G-reform? Okay, G-reform shape. Okay, so this one actually for your subarachnoid hemorrhage. Okay, now we look at the pia meter. Okay, your pia meter. Okay. So if let's say we cannot complete today, we will continue next week. Okay. So for the pia meter, actually is a thin, transparent vascular membrane which is closely immersed the entire CNS and follow its contour and continuous with a perineurium of cranial and spinal nerve. So that's why they call it as a closed mother. Okay, they call it as a closed mother. So you can see that we have in the cranial pia, we have a thalachoroidae. Okay, certain things that you have to know related to the pia meter. We have a thalachoroidae and also the choroid plexus. And then in the spinal pia, we have just now is the denticulate ligamentum, okay, denticulate ligamentum or ligamentum denticulatum, and then also the filum terminale. Okay, so actually both it will helping give stabilization to the spinal cord. So one is a running downward, the other one is a running laterally. Then, so we have a denticulatum here, so around 20 to 22, triangular shaped flattened band. And then if you say the important clinical important related to the denticulatum here, actually your chordotomy. Okay, you can do the chordotomy in order to give reduce the pain to the patient. Okay, you can cut do the chordotomy. So this is actually the pia meter. You can see yang green color. Okay, this is actually it closely covered, and then it follow your contour of the brain. Okay, follow your gyrus. Okay, follow your gyrus. So invest the brain, covering the gyra and descending into the steeper sulci and closely applied to the cortical surface. So and then something related to the pia meter actually is your thalachoroidae. So the pia meter, if you can see from here, okay, you can see that we have the covering here. So the blood vessel, okay, the blood vessel will go together, okay, together with your pia meter. Okay, it will go together with a pia meter. So it running together to your brain. Okay, go to your brain. So it will form like a thalachoroidae. Okay, forming the thalachoroidae. So the thalachoroidae together with the ependymal cell here, it will form the choroid plexus. So the choroid plexus function, actually it will produce what? It will produce your CSF. So you can see from here this diagram, the coronal section of your brain. You can appreciate that it connected by what we call this structure, connected to hemisphere, known as a what?
Two hemisphere.
Huh? What do you call? Huh? Known as a what?
Connect.
So known as a CC kan? Corpus callosum. Okay, corpus callosum. So you can see this is actually the corpus callosum, and then look at this is actually the lateral ventricle. Okay, the lateral ventricle, where the lateral ventricle here is separated by the septum pellucidum. Okay, the septum pellucidum. So look at the choroid plexus inside the lateral ventricle, and then the ventricle actually is lined with a ependymal cell. So how the ependymal cell is look like? Okay, you recall that you have been in the HP. What shape of for the ependymal cell? Huh? Is it squamous? Huh?
Kolam.
Come on lah, you nak periksa professional.
Cakap je kolam lah.
Fine.
Ya saya.
Shape of epidermal, columnar, squamous.
Ependymal cell is a brain cell or is it glial cell? Glial cell kan? So ependymal cell is look like a what? Squamous cell kan macam mana? It's a cuboidal kan? Cuboidal to columnar. Okay, cuboidal to columnar.
Betul lah.
Also the macroglia. Maybe cilia and also the
Squamous ke
macroglia.
kolomnar?
Columnar, cuboidal columnar.
Oh, kolomnar.
Okay, now so we we now enter your ventricular system. Okay, your ventricular system.
What's that?
So for this one, make sure you can know how to illustrate and describe what the ventricle, describe the structure of the ventricle, and illustrate and describe the cerebrospinal fluid formation, absorption, and circulation. So this one, just revision to you. So we have a ventricle, we have a lateral ventricle. There is no second ventricle, yeah? No second ventricle because we have two lateral ventricle, okay? And then the third ventricle and the fourth ventricle.
Macam mana nampak?
So the two lateral ventricle, two in the midline. Okay, we have the fourth ventricle and also the third ventricle. So and then got opening, okay, got opening. So a connection between your lateral ventricle with your
Slide tu macam, do you remember?
Lateral to the third via the foramen morbo or interventricular foramen, and then from the third ventricle to the fourth through the cerebral aqueduct or sylvius aqueduct, and then from the fourth ventricle go to your subaerial space through your lateral Lashkar or Lashkar opening, and then the other one is a Meganti, okay, the Meganti opening. So you can see from here, this is actually the two interventricular foramen, or we call it as a foramen Monro. And then this is a third ventricle, and then connection to your third to the fourth here via the cerebral aqueduct. So we have, you can see from lateral side and also from the anterior side, okay, from the anterior. So this is actually the opening for the from the fourth ventricle to the subaerial space, how it drains your cerebrospinal fluid, right, through your lateral aperture or Lashkar, and the other one is a immediate aperture, or we call it as a Meganti. Lashkar L lateral, okay, Lashkar lateral, and the Meganti is a medial opening. Okay? The opening, and also it will be continuous with the central canal of the spinal cord. So it continuous with the central canal of the spinal cord. So for the lateral ventricle, it consists of two curves. Okay, macam you punya buat tangan macam ni, so that you can appreciate. So this is your frontal part, and then we have a body, and then the got atrium, and then this part actually your what the posterior lobe, and this is the inferior lobe, right? Like this, you can appreciate. So we have here the lateral ventricle is actually separated by the septum pellucidum. Okay, it is not connected each other. Okay, it's not connected. So it's separated by the septum pellucidum, and then you can appreciate from here how from the lateral ventricle it will be drain the CSF to the third ventricle to interventricular foramen. Okay? And then from this diagram also you can appreciate the fibers inside the cerebrum. Okay, we have the commissural fibers, the association, and also the projection. Okay? Association, the commissural, and also the projection. So this is how you divide your lateral ventricle. We have a anterior horn, okay, and then the body, okay, or the splenium, and then the posterior horn, and also the inferior horn. So in between here there is a tricon, or we call it as the collateral tricon, or we call it as an atrium. So where you can find your anterior horn? Your anterior horn located in the frontal, okay? Your anterior horn located in the frontal. Your body of the lateral ventricle, or the central part here, located in the parietal lobe, okay, in the parietal lobe, and then the posterior horn located in the occipital lobe, and inferior horn is located in the temporal lobe. Okay, so the junction here, okay, the atrium here, junction between the body and then the posterior and inferior here, we call it as a collateral tricon, or the atrium. Okay, the atrium. So make sure you know part of the lateral ventricle. Very easy kan? Macam tu. The anterior horn located in the frontal, body, your parietal, and then your inferior located in the temporal, and then the posterior horn located in the occipital lobe. So more detail you can read by yourself about the relation. Okay, saya takkan tanya sebab macam banyak kan. I will not ask you. So many things. So if you want to know further, you can see from this part which one forming the roof for the anterior horn, the medial wall, and the floor for each of the part of the lateral ventricle. Right?
Dia cakap dia takkan tanya. Tak. Okay.
So now we look at the third ventricle. So what's so special about the third ventricle? So you can see that it having relation with a thalamus. Okay, lateral to it presence of the thalamus. The third ventricle having relation with the thalamus. Okay, the H shape here. So and then how it communicate? Okay, anteriorly with the lateral ventricle through the foramen of Monro, and then behind or posteriorly with the fourth ventricle through the Sylvius aqueduct. So you can see from here the fourth ventricle. So anteriorly it having communicate with lateral through the interventricular foramen, and then posterior or behind it will communicate with fourth ventricle through the Sylvius aqueduct. So this is shown to us the lateral ventricle. Okay, so you can see that lateral to it presence of the thalamus. So many thalamus with many nuclei here. Okay, you can see lateral to it. Saya pun suka guna gambar ni untuk example. Okay, you can appreciate that how actually the
Sangat suka ya. Sangat suka.
okay, so you can from here also you can see that how the lateral
Gini-gini
ventricle with
hati.
a correct plexus inside, and then we have a body of the fornix, and then separate by the septum pellucidum. And then look at the third ventricle here. Okay, the correct plexus in the third ventricle.
Gitu.
Right, and then this is actually your thalamus, and then the hypothalamus. Okay, now we look at the fourth ventricle. So the fourth ventricle is look like a rhomboid. Okay, a rhomboid or diamond shape. Okay, so this lateral to the anterior to the is this fourth ventricle here is located anterior to the cerebellum, and then anterior to the cerebellum, and then behind is located behind to the pons and upper part of the medulla oblongata. Right, this part posterior. So in anterior to the fourth ventricle, we have part of the pons and upper part of the medulla oblongata. So look at this one here. You see that you can appreciate that anterior to the fourth ventricle presence of what? Pons here and upper part of the medulla oblongata, and then behind consists of the cerebellum.
Ini kita lah atas sana.
Okay, this part fourth ventricle. Okay, and then if you look at the fourth ventricle here, so the superior part, okay, the superior for the fourth ventricle here is formed by the superior medullary velum. Okay, they call it as a superior or roof. Okay, roof for the fourth ventricle here. Okay, presence of the superior medullary velum, and below presence of the inferior medullary velum. So anteriorly presence of the pons and the superior part of the medulla oblongata. And then if you remove the spine, the cerebellum, you remove the cerebellum and you view from the dorsal part. Okay, you view from the dorsal part, you can appreciate that presence of the white. This actually it's look like a rhomboid in shape. Okay, rhomboid in shape. So we have here the medial sulcus, and then the median eminent. Okay, the median eminent, and then look at the vestibular area. Okay, the vestibular area, and then presence of the stria medullaris. Okay, and then the right triangle. Okay, the hypoglossal triangle, and also the legal triangle. And this is actually the junction. So we call it as a obex. Okay, the obex. So half of the ventricle here, fourth ventricle, is formed by the part of the pons, and another half is formed by the upper part of your medulla oblongata. So this is the things that we saw just now. Okay, they were actually the facial colliculus. Okay, this is actually your facial colliculus. How your facial nerve round. Okay, your facial nerve curve. Okay, curve around your loop around your abducens nerve. So it forming the bulging. Colliculus to like the bulging. So we have a facial colliculus, superior colliculus, and then the inferior colliculus in your quadrigemina of your midbrain. And then the hypoglossal triangle just now, below to it presence of the hypoglossal nuclei, okay, or nucleus, And then the stria actually it separate between the anterior and posterior, the part above and the below here. And then we have a vagal tricon. Below to it, presence of the vagal nucleus. So when you learn about the brainstem kan, it's not easy. Senang ke susah? Brainstem? Susah. But you can try to draw this. Draw from the cross. Saya pandai lukis. Saja tu. Okay, and then also the vagal tricon because below to it presence of the vagal nucleus. Okay, and then actually very important. Contrary to it can cause a fatal. And then lateral to the diagram here, we have a vestibular area. Okay, the vestibular area for your equilibrium, kan? Okay, your equilibrium for your vestibular cochlear nerve lah. Alright, and then the area postrema below to the tricon. Then we have a opex. So any application related to the structure of floor of fourth ventricle, we have infratentorial tumor. Okay, infratentorial tumor. So that means the tumor is located below your tentorium. So your tentorium to divide your superior tentorial region, and below to it we call it as a infratentorial region. So tumor in the infratentorial region, okay, in the infratentorial here, it can cause a blockage of the foramen of Magendie and also the Lashka. And later on, what will happen? It can increase the intracranial pressure, and then of course, increase the intracranial pressure will cause you headache, kan? Okay, headache, projectile vomiting, and also your eye will kebauching, macam tu. It can cause a papillo edema. Okay, so this is shown to us how you can draw your brainstem, okay, from your floor of the floor for the fourth ventricle. Okay, the schematic diagram for the floor of the fourth ventricle. So central canal actually is a continuation from your fourth ventricle, go downward as a central canal inside the right spinal cord here. So bear in mind the central canal is lined with ependymal cell, but it's not appear. Okay, the correct axis is not appear inside the central canal. Okay, only the correct axis appear inside the ventricle. We have the lateral ventricle, third ventricle, and also the fourth ventricle. So you can, from diagram here, you can appreciate the correct axis inside the fourth ventricle. Alright, so can we stop here? Or you want to proceed? Okay, we continue later with blood supply. Right, okay.